Hi, my name is Sharon, and I'm here to tell you about the St. Catherine University online OTA program. There will be an opportunity to ask questions at the end of this presentation. If you'll utilize the chat function in the bottom right-hand corner, I'll answer questions based on what's coming in through there. All right, let's go ahead and get started. So what is an occupational therapy assistant? So occupational therapy assistants actually work under the direction of an occupational therapist. They're typically working with patients more one-on-one because they're implementing the treatment plans. Typically, your occupational therapist writes the treatment plans, and it's the OTA that acts upon the treatment plan and then makes any recommendations to edit them as needed. There's 6 different OTA practice areas that include children and youth, productive aging, working with the elderly, health and wellness, mental health, rehabilitation and disabilities, and work in industry. We hear a lot of the time people not understanding the difference between occupational therapy assisting and physical therapy assisting. So there are quite a bit of differences between the two different healthcare fields. So a physical therapist would help someone perform movement or gain mobility, where an occupational therapist works with somebody to perform activities of daily living. So for example, if you had rotator cuff surgery, you would work with a physical therapist to gain mobility back in your shoulder, where an occupational therapist, if you lost your arm in an accident, they would work with you to learn how to perform daily living activities such as cooking, cleaning, putting your clothes on, brushing your teeth, things like that. So why look at getting into a career as an occupational therapy assistant? There's quite a bit of demand and growth in the OTA field. It's actually one of the fastest growing healthcare occupations. The Bureau of Labor and Statistics projected it will grow roughly 40% by 2024. A lot of that demand is going to be caused by the elderly population, the health needs of baby boomers, people retiring, things along that line. It was also ranked one of the #1 jobs in best healthcare support jobs by U.S. News World and Report. And then according to the Bureau of Labor and Statistics, the average salary for an OTA is roughly $59,010 a year. So as I mentioned earlier, there are 6 different settings that occupational therapy assistants could work in. Some examples of those settings would be homes, whether that's private care, doing in-home health care, school settings. You can work in a workplace. So OTs and OTAs can actually come into businesses and work with them to set up conducive environments for employees. You can work in a hospital, skilled nursing facility, a rehab center, and therapist's office. So naturally, the most lucrative sectors right now are going to be home health care and nursing care facilities, as I mentioned, due to the baby boomers retiring and the elderly generation. So a little bit more about St. Catherine's online OTA program. 80% of it is online, but you're still going to get hands-on experience, and that's that 20% on-site. So we have labs and fieldwork experience, and that's when you're really going to get exposure to OTAs, working with patients, and then your coursework itself is actually 100% online. You're not having to travel to any sort of testing centers to do proctored exams or anything like that. But the program itself is not considered 100% online because you're still attending the labs and fieldwork. So with labs, you'll actually attend 12 different labs where you'll learn more about the 6 core OT practice areas. In addition to that, you'll do 720 hours of supervised field work. We have a main campus located in Minneapolis and St. Paul, Minnesota, but because this program is online, we actually don't have multiple campuses all over the United States. So we have lab sites located in Virginia, California, and Texas. You do not need to live in those states in order to attend our program. We actually have students all over the United States that participate in our program. And I'll talk more about labs and field work and what that's going to look like in a future slide. So one of the other great things about our program, we have a couple different curriculum options for you. So in our program, you have to complete occupational therapy assisting courses in addition to liberal arts classes, which are commonly referred to as LAS. You have to complete classes in both OTA and LAS in order to graduate. One option you can do is take your OTA classes while you're taking LAS courses. If you go this route, it typically takes students about 16 months to complete the program, assuming you've got all of your prerequisites completed. It is a little bit heavier of a course load, though. The other option is for you to start off taking your LAS courses with us. Then you can start your OTA classes at a later time. So depending on the number of courses that you may have transferred in would determine the length of time it would take you to complete the program. But you're able to knock out more of your coursework in the beginning, so you have a lighter course load when you're starting those OTA classes. We also have 3 starts a year. So we start in January, May, and September. We are regionally accredited by the Higher Learning Commission of North Central Association of Colleges and Schools. In addition to that, we are accredited by ACOTE, which is the Accreditation Council for Occupational Therapy Education. In order to fit for the MDCOT, which is the national exam you have to pass in order to become a certified OTA, a school must be accredited by ACOTE. Some of our admissions requirements, you do have to have a high school diploma or a passing GED. If you have high school education only, you're required to have a minimum cumulative high school GPA of a 2.5, or if you've got college experience, you need to have a cumulative 2.5 GPA as well. In addition to that, we have 4 prerequisite courses that must be completed prior to starting OTA classes. We currently do offer these prerequisite courses, so you can be admitted into the program, start your prereq courses and some of your liberal arts classes, and then as long as you have a 2.5 cumulative, you're eligible to start the OTA classes after completion of those. With the prerequisites, you have to have a C or better in all 4 prerequisites, and you have to have a minimum cumulative GPA of a 2.5 on those prerequisite courses. A little bit more about our online OTA program. Here at St. Catherine University, we like to think of ourselves as OTA pioneers. So in 1964, we were one of the first universities to ever launch an OTA program in the United States. Then in 2014, we were one of the first universities to offer an online OTA program. So we've got a lot of history in the occupational therapy field. All of the faculty and professors are practicing OTs, and they've got lots of real-world experience and knowledge that they pass on to our students. One of the other things that's really unique about St. Catherine University is we offer something called an MDCOT prep coaching program. Not a lot of other universities with OTA programs offer this. As I had mentioned, at the end of our program, you have to sit for the MDCOT in order to become a certified occupational therapy assistant. You have to become certified in order to practice. So the MDCOT can be an intimidating exam. It's a 200-question exam. You go into a testing center and you sit through and test. we've developed a coaching plan to help set you up for success. So we'll work with you one-on-one. You do participate in weekly group sections, and they break down how to study for you. So once you complete your fieldwork 2, you'll work with a coach and come up with a designated study plan. All right, so I'm going to go ahead and answer some questions that have already appeared in the chat box. So the first question I have here is, can I work while in the program? So great question. We do have students that work full-time and part-time while completing the program. Once you get to your fieldwork 2, you will not be able to work full-time. In your fieldwork 2, you'll be at your placement for 40 hours a week for 16 weeks straight. And that's typically Monday through Friday. And you have a patient load while you're completing your fieldwork 2, and you're having to do documentation, things like that. You're essentially a practicing OTA. So there are times that you have to take your work home with you, and you'll still have some small assignments that correlate with your fieldwork experience. When you're just taking those LAS courses, as I mentioned, as a program track option, it may be a little bit easier to work full-time. Once you get into the OTA classes, we do have several students that drop to a part-time, or they cut their hours roughly to 30 to 35 hours a week. Our OTA classes are accelerated, so they're only 7.5 weeks long, so they go by very, very fast. Another question I have here is, how do the online classes work? So with the classes, as I mentioned, they're 100% online. You participate in discussion post, which is equivalent to in-class discussion. You'll complete various assignments. There's one assignment actually in an OTA class where you'll record yourself completing a transfer, and you'll actually submit that to the teacher. So we do make assignments interactive. The next question I have here is, what is the difference between labs and fieldwork? This is a great question. So labs occur roughly once a month on a Sunday from 12 to 5. You will not start attending labs until you start your OTA classes, and that's when you'll get that exposure to those 6 key areas of practice in occupational therapy assisting. So in this environment, you're working with other students in the program, you'll have a designated instructor, and it's a safe environment for you to practice all the skills that you've learned in the prior weeks of learning. Then you'll complete your fieldwork hours. In your fieldwork, you're actually in a setting working with patients. So your fieldwork 1 will happen in your 2nd semester, and it happens right after your labs. So for example, you'll attend lab on a Sunday, then you'll complete your first fieldwork experience Monday, Tuesday, and Wednesday, following that lab on a Sunday. The unique thing about our fieldwork 1, it's actually a group model. So you'll be in your fieldwork setting with the students that attend your lab. You'll do this 2 times in your 2nd semester. Then in your 4th semester, you'll complete your fieldwork 2 experience. And that's when you're working 40 hours a week for 16 weeks straight. In both of your fieldwork experiences, you're getting exposure to a variety of people, different demographics, different patients, so you have a fairly well-rounded education and experience by the time you sit for the MBCOT. One of the other great things about fieldwork is you can actually put those hours on your resume as experience after you graduate. If I start prerequisite courses at St. Catherine, when could I start OTA classes? Again, great question. So it really would depend on the pace of the program that you would feel comfortable with, depending on your current time commitments and the number of courses that may have transferred in for the liberal arts section. Typically, you'll take 2 prerequisites your first semester, and then another 2 prerequisites your 2nd semester, and then again, as long as you have passed all your prerequisites with a C or better, and you've got a cumulative 2.5, then you would be eligible for the OTA classes. One of the benefits of taking your prerequisites with St. Catherine University, or even taking LAS courses before your OTA classes, you're reserved a spot in the OTA classes. So you'll get first pick for the labs and things like that once you're eligible to start those OTA classes. What if I don't have a 2.5 cumulative GPA? What are my options? So one of the great things about St. Catherine University, we actually have admissions counselors that will work with you one-on-one to talk about your specific situation and evaluate all the options for you. So even if you don't quite have that 2.5, there may be an option available for you to still be admissible to the university. So I would highly recommend you get a hold of your admissions counselor, submit all of your unofficial transcripts to them, and they'll be able to evaluate things and let you know the best path for you. Can I still apply if I have international documents? Yes. So we accept students that are international students, or if you have international documents, your admissions counselor, again, is a great resource for you. They'll be able to walk you through how to obtain those international documents. If you need to get any evaluations, things along that line, they'll be a great resource for you there. One of the other things about St. Catherine University, in addition to your admissions counselor, they'll actually work with you and help you through the entire admissions process. So getting that application in, ordering official transcripts, completing financial aid documentation, things along that line. They'll work with you up until classes start. So you'll have somebody that's here to help guide you through everything. In addition to that, you'll also have an academic advisor that will work with you until you graduate. And they're here again to support you in any way that they can. We work with students to go over time management techniques, study techniques. You know, when you have a bad day and you just need to talk to somebody, we're all here to help set you up for success. So you have a high level of success and people that are here to help you. All right. It looks like that is it. I've answered all the questions that are in the chat box. I want to thank everyone for taking some time to listen to me talk about St. Catherine University's online OTA program. If you're interested in finding out more or taking the next steps, I would highly recommend reaching out to your admissions counselor